The United States is facing an alarming surge in coronavirus cases, with hospitalizations nearing 100,000 people. Hello, I'm Anand Naidu, and this is The Heat. The United States continues to lead the world with the highest number of COVID-19 cases. To date, more than 13.5 million people have been infected with the virus in the U.S., and nearly 270,000 have died. Advisors for the U.S. Centers for Disease Control and Prevention met on Tuesday and are recommending healthcare staff and residents of long-term care facilities receive the COVID-19 vaccine first. Pharmaceutical companies Pfizer and Moderna have applied for emergency use authorization from the U.S. Food and Drug Administration to deliver a vaccine in the coming weeks. A new report from the CDC finds that the virus was in the United States much earlier than previously thought, likely mid-December, and weeks before it was identified in China. In the last month, many hospitals have been overwhelmed with new patients and stretched to their limit. One doctor in California described the heartbreak of losing young patients.
There is something much more profound about a young death. And you don't even know how to process it when you have to call a young wife and tell her that her husband has died or that she's saying goodbye on an iPad. These things are incredibly emotionally and psychologically traumatizing. You know, it's not time to process that, so we kind of store it away and we keep it moving. But it is like a war. It's like going to war.
Yes, very traumatizing indeed. For more on the U.S. pandemic, let's bring in our panel. Joining us from Boston is Dr. Yaneer Bar-Yam. He's the president of New England Complex Systems Institute and co-founder of the COVID Action Group. From Washington, D.C., Joseph Williams is the senior news editor for U.S. News and World Report. Dr. Gary Richwald is a communicable and infectious diseases expert based in Los Angeles. And from Madison, Wisconsin, Dr. Jeff Pothof is the Chief Quality Officer at the University of Wisconsin Health. Thank you to all of you for joining us. Jeff Pothof, let me start with you and just look at the latest figures. There are now 96,000 people in hospitals around the United States, with 18,000 in intensive care units. You practice medicine at Madison, at the at the hospital in Madison, Wisconsin. What are you experiencing there?
We're seeing the same thing, huge numbers of patients. You know, again, today we broke our record for total number of COVID patients in our healthcare system. And, you know, we're worried that the Thanksgiving holiday is going to make that even worse. And we just don't have that much more room to stretch. It's getting to be a really dire situation.
You know, listening to that healthcare worker that we just did a moment ago, we can hear the concern, the trauma in her voice. What about staff and morale among healthcare workers?
Yeah, you know, this is really hard on staff. You know, they're the people that are there. There's no visitors. They're arranging that final Zoom, that final meeting between someone and their loved ones, and then it's going to be the end. You know, mentally, that's just really hard to do over and over again. And despite that, they're signing up for extra shifts. They're going the extra mile. They realize that they're part of something bigger than themselves. But make no mistake, it takes a toll on us. It's exhausting.
And what is the procedure at a hospital like yours when you get someone? Are they immediately put into, I guess they immediately admitted. At what stage are they taken to intensive care?
Yeah, the number one thing that ends up getting someone into intensive care is the inability to breathe on your own. Once you require a ventilator to support your respirations, you almost always have to be in an intensive care unit. And then the level of care just ramps up from there, whether you need bypass, we call it ECMO, whether you need special ventilation, proning. Those things are typically happening in an ICU.
All right, let's go to Los Angeles to do Gary Richwald. Gary, California has more people hospitalized with COVID-19 than at any other time since the pandemic began, and Los Angeles County, I should say, has just implemented new restrictions on gatherings and on the number of people who could go into a store for shopping, for instance. The governor of California, Gavin Newsom, is warning of a new stay-at-home order. Do you see California going into another lockdown?
Well, we're certainly heading in that direction. We're looking at a complete shortage. That is 100% full ICU beds by mid-December in Southern California and by the Christmas to New Year's period in Northern California. So we are running out of options as to what we can do in terms of holding back what was described as that Thanksgiving wave of infections that are heading our way.
And what about hospital capacity and staff in California?
Well, also, we're getting short to the point where people are being asked to work double shifts. I'm sure the listeners realize that when doctors and nurses are working long shifts, their propensity for making errors, for not being as efficient, goes up. So we are doing everything possible to make sure that we have very good staff present and awake and at the bedside, and that's the goal. We are not sure once we hit 100% ICU capacity what's going to happen. And as I said, that's mid-month in Los Angeles, and we're just less than 2 weeks from that now.
Yaneer Bar-Yam, as we just heard from our panelists, it could get worse after the Thanksgiving holiday. In fact, if we look at some of the figures here, anywhere between 800,000 and 1 million passengers passed through the country's airports this past Thanksgiving holiday. And Dr. Anthony Fauci says that we could see a surge upon a surge. Could it get much worse?
Unfortunately, the disease is just not going to follow our desires. If we do things that enable us to be infected, it will just get worse. The flip side of that is that if we actually take action, and as they just said, California may go into a new stay-at-home order. We have actions being taken in multiple states around the country, in New Mexico, in Rhode Island, but there hasn't been a concerted effort. One thing that we really should say to people is that there's no reason that we have to be at capacity of the hospitals. If we just did a really strong action, if we did the stay-at-home orders the way it's supposed to be, if we take it seriously, we can actually reduce the number of cases per day by a factor of 100 in just about 4 weeks. That sounds like a lot, but it's really possible. There's no reason that we have to have so many cases, and there's no reason that we should be counting hospital beds instead of thinking about how many people are being sick, getting sick, how many people are going to be hurt by this and die, and also the long COVID, long hauler, long-term effects of this disease. So really, instead of sort of having our back up against the wall when we have hospitals filled and sort of being forced into doing this, we should be proactive and really get down in terms of the number of cases dramatically by taking strong actions.
And Dr. Bar-Yam, there is a big focus right now on vaccines. Where are we in terms of vaccines, and who will be first in line?
So the vaccines are being rolled out, and the success in producing a vaccine so fast is very impressive. But so we have presumably some vaccine coming out, maybe even in December, maybe it'll take a little bit longer, and it will surely go first to the healthcare workers, and almost surely it will also go to the people who are in long-term care facilities next. But the main thing is that we cannot stop this disease in the population with just the amount of vaccine that we have over the next few months. It's going to take about 6 months, even in the most optimistic scenarios that we have. And let's hope that happens, but we really shouldn't be waiting. We do not want to have, as we have now, 150,000 cases per day, about 2,000 deaths per day. Even 1 month of that is a huge, huge price to pay. And of course, people really have thought that there is a trade-off between getting rid of the disease and economics, but the economics is not working in these circumstances. There is no example where people are living with the disease anywhere in the world that's working for economics. any better than if we're in just a lockdown all the time. So what we really have to do is to suppress the disease dramatically, and then we don't have the toll and we don't have the economic cost. We can get back to something that will and should be very much like the normal that we had before the disease came altogether.
Right. Joseph Williams, President Trump has summoned the head of the Food and Drug Administration to the White House. The FDA, of course, is the agency that will certify the use of these vaccines. What do you know about this meeting?
Well, the meeting is for President Trump to try to lean on the FDA and accelerate the approval process. As the physicians no doubt know, the FDA is going to judge whether or not you can get emergency use authority for any of the new vaccines, which means that they can skip over some of the previous requirements that might happen for a new drug. So the president is basically continuing his effort to look to the vaccine as kind of a Hail Mary here to not have deaths continue in the way they've been continuing, even though they could have been alleviated had we had strong national leadership and a unified plan to take on the virus. We wouldn't be in this situation where we're depending on a vaccine to stop the spread.
Jeff Pothof, there's lots of hope that we see in the vaccine candidates that we know about so far, but we don't have any details on the timetable yet. I guess we'll know that in the next few weeks. And there's also, of course, the issue of logistics. I know one of these vaccines has to be kept at a very, very low temperature, at an ultra-cold temperature. I mean, is there an infrastructure in place, especially at hospitals, to make sure that these vaccines can be used?
Well, I think what you'll see is an infrastructure that develops with different parts of the country developing it sooner than others. I can tell you here in Madison, we're meeting on a daily basis to figure out, where do we keep our ultra cold freezers? What would that injection plan look like? Where would we do it? How many people could we inject? But like some of the other panelists have said, this isn't something that just happens overnight. We might be ready to begin injections soon, but it's going to take months for us to get enough people vaccinated where COVID-19 is not a problem. In the meantime, the virus is, out of control. There's a light at the end of the tunnel, but there's a huge chiasm between where we are now and when everyone's vaccinated, and we really need to hold the line for the next couple months.
Yeah, Jeff, one of the other things I heard, I think it was from Pfizer, that company is saying that they are actually going to build what they call a cold line. I guess these are sort of refrigerators that will be able to keep these vaccines.
Right, and I think, this is, one of the drawbacks of some of these vaccines is that logistically they're so difficult to transport around the country because they require such, cold refrigeration. In the United States, that might be something that we can do in a lot of our more urban areas. It might be a challenge in rural areas. Once you expand outside the United States and look at some of these countries that just don't have those resources, those vaccines are out of grasp. So they're going to be looking at vaccines that don't require such sophisticated logistical transport systems.
Yaneer Bar-Yam, the company Moderna, they have applied for emergency approval from the FDA, the Food and Drug Administration. Pfizer has already lodged its application and is actually moving doses of the vaccine to distribution hubs. How do you see this rollout over the next few weeks?
So the first thing is that we don't have the behind-the-scenes information about the about the trials that have been done, and that has to be reviewed. We're waiting to see that released publicly. So that information still has to be reviewed by people who are able to understand what has been achieved in the current situation. And hopefully the merits of the information will then move the process forward, and the vaccines will be approved and moved into delivery as we've been told. So again, the process, it has challenges, first of all, in terms of approval of the trials. Now, again, they've been saying to the public that this is all set, but the information in those studies is not yet publicly available. And then the second part is, as we've been talking about here, is the logistics of the distribution, the cold temperatures. Those have been overcome, and those were even overcome in Ebola in West Africa, where there was similar requirements. It does take logistical support, but it is possible to take care of that.
Gary Richwald, you know, we've been hearing about who would be getting this vaccine first, frontline healthcare workers, of course, and then there are elderly people in long-term healthcare homes. But now you are an advisor. You represent a union. You're a scientific and health advisor to a union in Los Angeles. And you say these groups that you represent, and these are grocery workers, meat cutters, packers, pharmacy workers, that they should also be at the front of the line.
Well, you're absolutely right. And this discussion has been a mile wide and a quarter-inch deep. If we really look deeper, most physicians, if you look at the number of physicians in the United States, do not need this vaccine. I'm a physician. I work remotely and as an epidemiologist and as a clinician, and my risk is very low. So first of all, we shouldn't be saying, let's give this to all physicians. That's a mistake. I would say nursing homes are critical. Two groups that have not been mentioned, which there was a soon to be published article in Scientific American, talks about the group with the highest rate of infection, which is prisoners. And the second group is those people in jail. And it's the people in jail who cycle in and out of jail. They have a DUI, and then they're there for 2 or 3 days, and then they're released to the community. Those people have the highest chance of transmitting this infection into the community. So a lot of the discussion has been very simple-minded, and it needs to be much more acute. The Trump administration pushing this down to the states and large cities and counties on the surface sounds intelligent, but this is the federal government. We pay taxes. We should have advice from these people. And, you know, it's, to me, not going swimmingly well in terms of who should have the priority. The other thing I just want to say is that we have an opportunity to deliver this vaccine the same way we do testing at Dodger Stadium in Los Angeles. We will locate those freezers at Dodger Stadium, and as people drive through and get their tests or just get their vaccine, we will deliver the vaccine this way. Curative, which is the largest company in California in delivering testing, you know, these are the locations. It's the Costco parking lot that is going to supersede old-fashioned ideas about doctors' offices as the location to efficiently deliver this vaccine. This can be done. It's already being demonstrated with influenza vaccine at test sites. So we need to think forward, not backward.
Joseph Williams, there is one other major issue with vaccines, and that we know there are a lot of people, in fact, almost half the United States here, people who were surveyed in a Pew poll, who said that they would not be vaccinated. There is this reluctance to being vaccinated, and the distrust is highest among people of color, whom we, as we are aware, have been disproportionately affected by this pandemic. I mean, what's it going to take to assure people that this vaccine is safe, that they can take it?
Well, that's the paradox, right? That people of color are, African Americans specifically, are twice as likely to contract the coronavirus, a little over twice as likely to die from it. Latinos around the same proportions, maybe 2.5% more likely to contract, and about 2% more likely, or twice more likely to die. Basically, what it's going to take is a concerted public relations campaign. One of the reasons why African Americans are so reluctant, or there's a lot of skepticism, is because of the echoes of our dangerous past, our ugly past in the United States, where African Americans were unwilling subjects and unwitting subjects to medical experiments, and to a lot of black people in the community, this kind of smacks of that. Combined with systemic bias in the medical community and endemic problems between people getting access to medical care and then getting mistreated when they have access to medical care, that creates a system of distrust. So basically, it's going to take a lot of community leaders, a lot of religious leaders, faith leaders, people in the community who other people trust, to tell them that this is a good thing, that we need to all get on board with this, and that it is positive to take this vaccine, because it is going to do something to help reduce the spread of the virus in the community. It's something that we all need, and it's something that's desperately needed in certain areas of the United States.
Joseph, do you know if there's any plan afoot right now to roll out some kind of I guess, information program, education program?
Well, I was on a CDC call this afternoon, and they were talking about just that. Not only determining who gets the vaccine first, who's first in line, why they should be first in line. Among them would be caregivers in long-term care facilities, prison populations, but also the people who work in those facilities would be at the front of the line, the people who are earning low wages. But there also has to be a public relations plan, and Pfizer has one. Moderna, I'm not really sure about them, but certainly the CDC is taking their cue as well and trying to round up a bunch of influence leaders in communities to get them to talk about why it's important to get this virus and why it's important to take it and trust in science in this particular incident.
Jeff Pothof, as we heard earlier, this vaccine has been produced in record time. It normally takes years for a vaccine to come to market. AstraZeneca, which has developed a vaccine with Oxford University, says its drug is 90% effective. You took part in that trial at the University of Wisconsin. Could you tell us about that experience?
Yeah, this was back in September when here at UW Health, we were able to secure the clinical trial, that phase 3 trial. And one of the things we were worried about is, would people actually volunteer to be part of a clinical trial? And we knew it was really important because this was our best shot at closing the book on this pandemic. So one of the things that I wanted to do, I'd been talking with the primary investigator for the site here, was really model the way for other people to say, hey, if this physician who we've seen on TV, who's reviewed the data, is willing to roll up his sleeve and get this injection, maybe others would evaluate their risk and do the same thing so that we could get closer to, what we're talking about right now, which is vaccines available, for the public in the next several months.
Gary Richwald, we heard something over the weekend, and that was close the bars and open the schools. That's the latest advice from Dr. Anthony Fauci. In fact, New York City just announced that it will be reopening its schools, its elementary schools. Middle schools and high schools will still remain closed, but elementary schools will be reopened on December 10th. What prompted that change, and what are your thoughts on children going back to school?
Well, look, if you look at the well-being of children, and of course their parents as well, the idea of them being in school makes perfect sense. As long as the teachers and the administrators and that they have testing available, as well as proper disinfection and sanitation, and the architecture is arranged as good as it can be to socially distance the students, then I think this is a smart idea. But those are a lot of ifs, and my understanding is less than half the schools in the United States meet those criteria. And they're, I'm talking about the ones that are currently in session. So we have a long way to go to assure sufficient testing, monitoring, and all the other public health measures.
Right, and Gary, when you talk about the criteria, I'll get to you in a moment. I'll get to you in a moment, Yaneer. Gary, when you talk about the criteria, you talk about the 3% positivity rate. Is that the criteria they're using?
That's right, and I'm a little concerned that we need to take a deeper look at the teachers, and that 3% makes some sense, but like many, as been said by before here, we have not looked, the CDC has basically been disabled through this epidemic. And the answer, whether it should be 5% or 2%, we don't have those answers. Americans should be pretty outraged about that. But I just want to say the testing issue provides a window to our vaccine delivery system. One of the most successful things that has happened recently is mass testing. And I think the schools are beginning to lead the way there as well, both post-secondary as well as elementary schools.
Okay. Yaneer Bar-Yam, you wanted to say something?
I do. Apologies, though, I want to correct something. I had said that there was vaccines in West Africa and Ebola. It wasn't until the Congo where we had the vaccines in the eastern part of Congo. But I just wanted to make that correction. But going now to the school question, I do think that the sending kids back to school in New York is not a good idea. The positivity rate is high, but really, in general, we now know from multiple studies, both studies in multiple countries and specific detailed studies in particular countries, the transmission does occur in schools, There's been confusion about this because kids are often asymptomatic at the time of testing and at the time that they do the epidemiological analysis. And so we often don't identify cases in children, and therefore people have also not tested as much children. And the studies that are now out show that kids are infected, that they transmit, they can have super spreader events of many people, many adults or children that are infected by children, and they accelerate the transmission in the community. So we really don't want to open schools unless we have very, very limited transmission, and there's no place in the United States right now, or almost no place, that would qualify at that level.
And very quickly, Dr. Bar-Yam, one other thing is that the CDC wants to shorten the quarantine period from the current 2 weeks to 7 days. What do you make of that?
Look, unfortunately, people are trying to make things be in some way or another, some form of more convenient. But what we know about this disease is that the incubation period has a long tail. And surely at the level of 14 days, it's still at the level between 1% and 2% of cases. So even 14 days is a compromise. And what you really want to do is make sure, because what's going to happen is, let's say you even implement testing. They talk about implementing testing. You can get tested on day 1, 2, 3, 4, 5, all the way up to day 13 in a row and test negative. And on the day 14, you'll test positive. And there are about 1% of people, or a little bit more, that will happen with. And surely we don't want that to happen with people going out into the community and infecting other people.
Joseph Williams, I got one final question, and we just got about 30 seconds for this. Of course, we know that many Americans have lost their jobs because of this pandemic, and they are facing mounting financial burdens right now. What is the status of any kind of help coming from the U.S. Congress?
It's muddled at best. We have a bipartisan group of senators who are trying to jumpstart negotiations. They're south of what the Democrats want, which is about $3 trillion, but north of what Mitch McConnell wants, which is about $500 million, which really won't get the job done. So we're looking at still a continuing impasse. People are going to be stressed out because not long after Christmas, these benefits will end, and we will be in the throes of another recession. This is also another reason why leadership matters. And I've said this more than once on your program, but the virus gets the last word, and until we figure out how this virus gets tamped down, and if people are willing to take those steps, we will still be in this cycle, and we will still have all these problems facing us into the new year.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.